You also have Medanta that reported its numbers. We are joined by the management. We have Dr. Naresh Trehan, who is the chairman and managing director of the company, as well as Mr. Pankaj Sahni, who is the group chief executive officer at Global Health. A very good afternoon to both of you, gentlemen. Thank you so much for joining us on ET9. Dr. Trehan, let me come first to you. And if you could tell us what exactly transpired in the quarter gone by, if you could give us some highlights of the quarter, as well as to add to that, if you could explain to us how's the occupancy trends been like and what's your expectation for H2?
Well, we've seen a robust growth in the last quarter, and there is a continuum of demand for our facilities, even the mature ones, and Lucknow and Patna. And so we expect that it will keep going up because there is a sort of a very solid realization that Medanta is actually providing the highest quality of care to across all specialties on the same platform at as affordable a price as possible. So this whole thing that has caused this movement, we are only 1 year from our IPO. This is our first year. And we have seen the response from the public that their satisfaction levels, the fact that the quality of care is exceptional. So there are many, many factors that are behind this growth.
Right. Mr. Sahni, coming to you, in terms of growth outlook, how is that looking for different surgeries? Where are you seeing the growth?
So when you look at our performance across specialties, you will find that we have actually covered all the major specialties. If you look at the results which we've announced in terms of where the revenues come from across specialties, you will see approximately 25% of our revenues coming from our cardiac care. When you look at our cancer care, we look at cancer not only in terms of medical oncology and radiation oncology, but our surgical oncology work is spread out across our Kidney Institute, across our Gastro Institute, across our Neurosciences Institute. So really, whether it is from liver transplant and lung transplant to cancer care to cardiac care, and also some of the chronic care like endocrinology, diabetes care, hypertension, high blood pressure care, etc. We really do treat across the ecosystem. We've also added in newer specialties in our Gurgaon facility like pediatric care, mother and child care. So really covering the entire spectrum of care and really doing that at a very high complexity level. So we deliver care across the spectrum in all our facilities at a very high complexity level. And we believe that this mix of care across all specialties will maintain as we move forward. Another important point to mention when it comes to the outlook is that our portfolio of assets is actually quite well balanced between mature facilities, between new growing facilities and facilities that are up and coming in terms of our Noida facility and our newly announced facility in Delhi. So when you look at our outlook across the next couple of years, we do believe that the portfolio is well balanced. We have a good growth potentials coming from all types of assets. And we have a very, very robust balance sheet. We ended September with about 600 crores of net cash on our balance sheet. So all in all, I would say well positioned to capitalize on opportunities that we see coming in the months and years ahead.
Right. Mr. Sahni, let me stay with you, and I wanted to understand what's the employee cost trend that you're witnessing right now for H2?
So when you look at our employee costs, we've actually been working over the last several years to try to bring that as optimized as possible. But we do believe that it's very important for us to invest in the highest quality of clinical talent, which we've continued to do, not only in our newer facilities, but actually if you look at our facilities, our mature facilities as well, we've added in significant clinical talent over the last 12 months in our mature facilities. So our thought has always been to invest in our clinical talent, and we believe that we will continue to do that as we move forward. As far as the cost ratios go with respect to our manpower costs or our ratios with respect to manpower and revenue, if you actually look at it, it is amongst the better ratios in the industry. And we believe that some of that comes from the benefits that we have because of the economies of scale that we have. As you're aware, we have fairly large institutions, about 1,300 beds in Gurgaon, about 1,000 beds in Lucknow, and about 600 beds in Patna. So this scale allows us to get the benefits of operating leverage. And you're seeing that play out as some of our newer facilities mature, as some of those facilities add in patient volumes. You see that the benefits of scale will play out. And we believe that that to be an advantage for us, not only in terms of managing the costs across the network, but also in terms of our ability to serve a wide variety and a wide range of patients across the communities where our hospitals are.
Okay, thank you so much, gentlemen, for joining in with us this afternoon on ET Now, telling us about your company and the outlook going forward as well. That was the management of Medanta Global Health for you all on the channel.